timing of antiretroviral therapy after diagnosis of cryptococcal meningitis. Definition: cryptococcosis of cryptococcal disease is potentially fatal fungal disease. It is caused by one of two species, Cryptococcus pneumoformis and Cryptococcus gattii. These were all previously thought to be subspecies of C. Pneumoformis but have now been identified as distinct species.
Cryptococcus neoformans, a fungus that exists in pigeon and chicken guts and feces, causes cryptococcus meningitis in humans with weak immune systems. Cryptococcus meningitis is an inflammation of the meninges, the tissue covering the brain. The inflammation may spread to the spinal fluid and cause stiff neck. Once the inflammation reaches the frontal cortex of the brain, it may cause double vision, or even cortical blindness.
Causes: cryptococcal meningitis is caused by fungus Cryptococcus pneumoformis. This fungus is found in soil around the world. Cryptococcal meningitis more often affects people with the weakened immune system. Risk factors include AIDS, cirrhosis, active liver disease, diabetes, leukemia, lymphoma, sarcoidosis, recidivism, and organ transplants. Symptoms: unlike bacterial meningitis, this form of the meningitis comes more slowly over a few days to a few weeks. Symptoms may include fever, hallucination, headache, mental status change, nausea and vomiting, sensitivity to light, photophobia, stiffness.
Meningococcal meningitis is a bacterial form of meningitis that causes swelling and inflammation of the membranes covering the brain and spinal cord. It is caused by a bacteria called Neisseria meningitis, which naturally resides behind the nose and throat. When the bacteria breaks through the protective lining of the nose and throat and enters the bloodstream, the person contracts the illness. Once in the bloodstream, the bacteria travel to the meningeus membrane, which is the area surrounding the brain and spinal cord. From here, the bacteria enters the cerebrospinal fluid. It is here in the cerebrospinal fluid where the bacteria multiply freely and release poisons that cause swelling and inflammation in the meninges and the brain tissue. A rash may appear on the body. The infection causes shock, organ failure, gangrene, loss of limbs, or even death. The person affected by meningococcal meningitis may experience nausea, photophobia, severe headache, stiff neck, drowsiness, among other symptoms. The bacteria can spread through direct contact with nose and throat secretions, such as sharing a glass, cup, or eating utensils, kissing, coughing, or sneezing into the face of another person, or examples of how contact with another person's respiratory secretions might occur. Additionally, other behavioral factors can influence the risk of getting the infection, such as smoking, exposure to secondhand smoke, excessive alcohol consumption, fraternities and bar pain.
Exams and tests. A doctor or nurse will examine you. This will usually show facts heart rate, fever, mental status change, stiffness, a lumbar puncture, spinal tap is important text for diagnosing meningitis, This test is done to remove a sample of cerebrospinal fluid (CSF). Tests may be done including blood culture, chest X-ray, cryptococcal antigen in CSF or blood, CSF examination for cell counts, glucose and protein, CT scan of the hex, gram stains, other special stains, and culture of CSF.
A laser beam is fired at a sample of spinal fluid which has been mixed with silver nanoparticles, and this scattered light is analysed. This process creates a unique fingerprint, and from this scientists can establish precisely which bacteria is causing harm. It's believed this test opens up the prospect of efficient treatment for bacterial meningitis.
Currently, testing is done using cerebrospinal fluid, which is taken using a lumbar puncture, which is obviously painful procedure, and quite a lot of meningitis cases are in children, and particularly babies that haven't yet been immunised. The advantage here is we would only need a smaller amount of sample that we could carry the test out, and we could get more information back from that one test without perhaps even having to go back and take further samples from the child. The more information we can get back from a single test, the better.
This is a comparison of our new results compared to the old conventional methods that were used.
Strathclyde researchers say this technique could be refined further to offer an even faster diagnosis.
It's a quicker treatment because this method of detection is in a shorter time frame compared to conventional methods, which can take up to 36 hours.
Bacterial meningitis can be life-threatening and needs urgent medical attention. Most patients recover, but many can be left with a variety of after-effects. 1 in 10 will die.
It's important to remember that once you're in hospital, the disease is probably at a fairly advanced level. So therefore it's really important that this disease is caught early, so early recognition of symptoms and the signs are absolutely vital. Parental intuition plays a very, very important part.
Scientists say this test could be applied to detect other bacterial infections, including MRSA. Sharon Frew, STV News at Strathclyde University in Glasgow.
Treatments. Antifungal medications are used to treat this form of the meningitis. Intravenous therapy, while antibiotics be in the most common treatments, is often combined with oral medication, flucytosins, and oral medication fluconazole in high dose may also be effective against these infections and may be used later in the course of the treatment.
I got meningitis in 1993, rendered the body totally inoperable. I was in a coma, I couldn't walk, couldn't talk. The reversing process of my brain damage has taken over 20 years so far to rectify, and things were chugging along slowly but surely. But then a chiropractor called Heidi Grant, she said she could bring me this far, but this man she knew in Atlanta could bring me this far. So I first met Dr. Ted Carrick in Amsterdam. The first visit to Atlanta, I did 5 days treatment, and each day here was like 1 year back home. That's how rapid the improvements were. Speech, walking, balance, posture. Basically, the whole body just improved. It's almost like magic. You think that Dr. Carrick was a wizard. They analyze your eyes, use sophisticated equipment. It seems that they can They can tell what's happening in your brain by what they see in your eyes. The homework that Cancer prescribes have found by doing the homework it's as if the brain is the biggest muscle in the body. When you work the muscle we call the brain, the rest of the body seems to just improve as a result. Strength.
Possible complication: brain demences, hearing loss in the cephalus, seizures, antiretroviral B can have side effects including chill and stiffness, and sometimes kidney damage.
A tropical fungus that causes lung infections in both people and animals is here in Oregon. It's killing more than a quarter of the people who get it. News Channel 8's Wayne Haverly joins us with the latest information from researchers. Wayne?
Tracy, about 10 years ago, a similar fungal infection had a big impact in Vancouver, BC. There were about 100 people that were infected by this, but it was not nearly as strong as what we're talking about now. This is a new strain of that same fungal disease. It's called Cryptococcal gadia.
Conclusion: cryptococcal meningitis is fatal without treatment. Forest rapid recursion of the symptoms such as fever and headache, and diagnosis is required to decrease the mortality recurrences of the meningitis after treatment should carefully be followed up, especially in advanced HIV patents.